Hi, Heather here. I promised you a video on opiates, so I named it Opiates, the Good, the Bad, and the Ugly. I want to talk a little bit about what we talked about in the last video. And so what we talked about in the last video was when a illness becomes chronic. Chronic illness is usually a term that they use after you have had 3 months of extremely fantastic treatment and your body continues to be not at rest, not improved, not better. For what they would call an acute illness would be like cold, flu, etc., that you get over within 3 months. A chronic illness is one that you don't get over in 3 months. Now, in this particular video, there's a different charge to it because you have this little teeny window called your second 3 months that you might can make it, to where if you have been in a motor vehicle accident, you've been assaulted, you have been, hurt at work very badly in your back, any type of traumatic injury that leads to the chronic illness called chronic pain is why I'm talking about opiates today. Because chronic pain is basically a severe illness that does not get enough attention, nor does it get treated properly. And that's why I'm here today to tell you how to get by that. Now, I do realize there's people out there that take opiates to feel great, and they're the ones that are at the doctor's office. And you know what? Some of them are addicted. Some of them are addicted to hydrocodone, oxycodone, alcohol, drawing pictures, cleaning your house. I mean, addiction is like huge. You can be addicted to so many things. But this particular video is about opiates. So let's talk about the good opiates, since we're doing good, bad, and the ugly. When you're first injured in whatever accident or whatever issue comes up for you, disease, having even a baby can be enough to put you honestly into a chronic illness. And so I want everyone to be prepared for this. That's why it's so important when we're getting ready to be pregnant and we get pregnant that we take very good care of ourselves and we know what we're doing, okay? That's for a whole different video for midwifing. But that is a stressor. And anything that creates an enormous amount of stress to the body, say a hit from a car, in my case, a hit from a patient, or a hit from another car in my instance. I've been hit a lot. What'll happen is that you get a dog. And also what happens is that in the first week to 2 weeks of that particular injury, you will be in shock. All the body's blood goes into the inner organs, the heart, lungs, intestines, stomach, everything, gets blocked off but the heart or lungs, basically. And your brain doesn't need to work for you necessarily to live, except for the back area called the cerebellum. And so for the first 2 weeks, a lot of people may say that you're on drugs because you are. You're on the natural endorphin, what I call the endorphin rush. What happens when you're injured is your body secretes a hormone called endorphins. That is the very first and the very best narcotic that I will talk about. It completely takes the pain away. You're in so much shock, you don't know what hit you. And usually they'll say to people that have been injured, they'll say, well, let's wait 24 to 48 hours to see how your body is responding. Most people will be hurting after 24 to 48 hours if they're not able to ice the site, constrict the site. It's called RICE. RICE means rest, ice, compress, or elevate an injured part of the body. Now, let's say you're in a bad accident like I was, and it was my pelvis and hip, or let's say I was assaulted by a psychiatric patient, which did happen, so it was my neck. It's very hard to constrict ice and all that business, when you're alone and you're in that much pain. So again, though you do have endorphins going, and I will say that they did take a urine test, and no, I was not on any medications at the time. I know this for a fact. And what secreted out of my blood, because I was so incredibly stressed after being assaulted by the psychiatric patient in August 20th of 2005 that broke my neck and my shoulder and gave me ligament tears, that endorphins actually were secreted into my bloodstream. which led workman's compensation and the people I worked for to think that I was on narcotics, which I was, my own, which made them say not to come back to work. And then they sent my urine out again to a special lab where it showed that no, there was no narcotics in my bloodstream at all. That is how strong your own natural endorphins are. Now, when you get into a chronic pain issue after 3 months, you've got like a teeny window of 3 more months before you're going to be what they call in chronic pain. And that's a pain level and a pain scale that goes from 1 to 10, 1 being no pain, 10 being severe pain. If you're still in severe pain from 5 to 10, meaning you need to be at the hospital, but don't go, they won't give you anything for it anyway, trust me. But that's how serious you hurt. It's not a joke. It's not a joke, and it is very painful. And if you're going to be that way forever, you're going to need some help. So the good news is you do have natural endorphins for the first 2 weeks called shock, and then that goes away and you can feel the pain. And hopefully what will happen is you'll be put into a good physical therapy, which is a lot of exercising to hopefully get your injury moving, the blood to it so that it can heal. However, if we're running into that 3 to 6 month mark, you may need a narcotic for that. Now, going to a pain doctor or a pain clinic, both of which are anti-pain, anti-comfort. Okay, I call them anti-comfort. It's not their fault. It's the DEA, unfortunately, and it's also related to a medication that you probably wouldn't think of. In a Norco, which is a hydrocodone, or a Percocet, which is an oxycodone, there's something in there called slash 350 milligrams of Tylenol. Or in a Vicodin, which is a hydrocodone, there's 500 milligrams of hydrocodone. If your body takes in over 3,000 milligrams of Tylenol a day over a period of 4 to 6 weeks, you run a very high risk of getting liver damage, liver poisoning, liver disease, liver cancer, die. That's how bad Tylenol is. So all this hydrocodone, Norco mess that's been taken off the market is related to, well, for one, more strictness so that we're not comfortable, I guess, but also to get you off that Tylenol. And you yourself need to take care that you're with a doctor that does pay attention to that, because if you do end up getting, we've looked at the good part of opiates, that's endorphins. Now we're going into the bad part of opiates. If you actually go to a pain doctor or go to a pain clinic, they are going to put you on a regimen. You will be given a medication probably called tramadol or Tylenol number 3 with codeine, which makes you very sick to your stomach, and they will not give you Phenergan, which is a good medication to take to help you rest and keep you from throwing up. They don't want you to get addicted. Again, we're still at the bad aspect, all right? So what will happen is that I would just suggest going in there and letting them know first and foremost that you're not a dummy, you know what's happening, you know about the pain scale, and give them your number. Honest number, feel your body. What number of pain are you in that 3 to 6 month period? If it is above 5, I would think it would be a good idea for you to potentially be given a tramadol. Tramadol is a non-narcotic medication, and just go with it. Because what you are able to do is you are able to talk to the doctor if it doesn't work, okay? And keep in mind that you are going to be watched, okay? Watched, because the doctor's license is on the line for giving you any type of narcotic. So now that we're at the bad part, you're going to be getting urine specimens almost every time you go in, but they're random. If they find any form of alcohol which stays in the system within 12 plus hours, 24 hours maybe, I would stay clean from alcohol for 24 hours. They will not give you a narcotic ever. And you will probably be sent to their addictionologist if it's a pain clinic. So to just be safe, try the tramadol. It may work. And go and continue doing that teeny bit of 3 months of rest, physical therapy exercises, and your tramadol so you can get through your exercises. However, if you run into the ugly aspects of chronic illness / chronic pain illness, and after 6 months you have tried everything, you've done it all, and you're still in about a 5 to a 9 to 10 of pain, I am sorry, but I really want us to find a pain doctor, not a pain clinic. Pain clinics have anesthesiologists Their main mode of action is to give you steroid injections. Let me tell you right now, a steroid injection is 1 cc. 1 cc is this much, okay? You're allowed to have 3 of those a year, okay? Otherwise, what happens is if they give you more than that, you run the risk of cutting your immune system completely off. It'll die from too much steroids. Unfortunately, some doctors, such as mine, decided 35 steroid injections in my neck, and this is before we knew, because I was desperate after 3 months to get pain relief, that I had a broken neck, a broken shoulder, and all my ligaments were torn from the patient attacking me on August 20th of 2005. The steroids did absolutely nothing except for completely wipe out my immune system, which in and of itself is not good. Think about HIV and AIDS. That is what AIDS is. You have no immune system. So you're going to start developing other issues, other disease processes as a result of them being negligent by giving you steroid injections. So any physician you go to, especially pain, ask them about that and let them know that you are completely 100% allergic to a steroid injection unless it's for life-threatening things such as you are so completely allergic to strawberries your throat swells up. You would need 1 cc of a steroid injection. But overall, it's a pain management thing, which is what they'll push in a pain clinic, and you're dealing with physical assistants, not nurses, who only do medications. They don't do care. They help the doctor do, their pain medications on paper to give to you. That basically what'll happen is you'll end up like I did, and that is with a chronic pain condition and no immune system. Not good. So I tell you that because I want you to know that the bad aspects of going on to, say, a stronger opiate, we've discussed that it's going to create a whole big scene where you're going to be watched. And then the ugly is this. If you really, really do suffer from chronic pain after 6 months and you cannot hardly stand being even resting, it's so uncomfortable, you can't do any exercise to save your life, you are going to need to find a physician that's going to prescribe you hydrocodone. And the fact that you've been willing to work with the doctor with the tramadols and the smaller stuff is going to give you a better heads up to being able to get fixed up. And I would stay away from pain clinics. Go to pain doctors, okay? And you're developing trust. So the urine specimens you'll be getting are very specific. In other words, when you go in for your doctor's appointment, you better have exactly what that says on your prescription. 6 times a day. That's 6 pills of Norco, hydrocodone, or Percocet, oxycodone, okay? Or in some cases, morphine 3 times a day. Okay, and that lab test will tell exactly how much you've been taking. So if you took it all in the first week and a half, and you're not ready for the last 2 days, you're going to get caught, and they will not give you what you need to help you to get better from your chronic pain condition. So anyway, when you start taking opiates, you feel great, but you still are damaged. It does nothing to fix you. You could almost hurt yourself worse because you feel so great. Not good. However, there is a time and place to where after you've traveled and tried for 6 months and you're still in that much pain, that when you take Norco, say a 5 milligram with, say, 325 milligrams of Tylenol, you can do your dishes. Or you can actually go get your groceries. Or you can go on a date. Or whatever you want to do. It will open your life up. However, the DEA is watching that doctor. So the minute you are on a chronic pain management, you are seeing that doctor every month for years. You are having to go and show your driver's license to the pharmacy, and hopefully their policy goes along with your timing, or what will happen is you are physically addicted to this medication and you will go into detox symptoms such as vomiting, chills, cramping in your intestines, just literally convulsions if you're not in a hospital. So that's the ugly aspect of having to become an opiate addicted pain client, is that, yeah, you can live a life for a while and eventually that medication will wear off, but it beats nothing. But you have such a bad chronic pain condition that you have to be on these medications. And there is no judgment in that. It's just the way we go about it, okay? And realizing that you will not be able to move, you will not be able to go on a vacation, you will not be able to take a long hiatus away from your central area where you live because you're going to have that medication every month or you will be hospitalized because now you're physically addicted to a narcotic, but you're comfortable. And sometimes when you weigh out those two things, staying in town versus traveling around is a better choice if you've got that much pain when you're dealing with chronic pain illness. Hope that helped. We'll talk more.